Unveiling since CEO Marissa Mayer took over. I'm Deborah Costrin with the Bloomberg after the Bell Report.
All right, well, East Cooper knows health, and that includes helping you when it comes to dealing with a hospital stay. Doctors Brian Wirt and Janet D'Agostino join me right now to talk about something that's known as a hospitalist. You guys are both hospitalists. That's right. Hard to say. And what is a hospitalist?
Well, a hospitalist is a physician who is either trained in family medicine or internal medicine. Sometimes there's pediatric hospitalists, but for the most part, general adult medicine, and their professional focus has been only on taking care of acutely ill and hospitalized patients. Really rarely do they have outpatient practices. Most of the time their office is at the hospital. So as primary care doctors have stopped coming to the hospital to take care of their patients, they have relied on us, who are there regularly throughout the day, to focus on taking care of their patients.
I guess the next question is, what are some of the advantages of seeing a hospitalist for your inpatient hospital care? What's the benefit for folks when they see you guys?
Well, one benefit is that we as hospitalists have clinical expertise when taking care of complex hospitalized patients, because it's what we do on a daily basis. Additionally, because our office is essentially in the hospital, we can be readily available to answer nurses' questions, meet with families, follow up on tests, and we could really be there if something critical is going on with a patient. Additionally, because we are there routinely, we're there to follow up on tests quickly. We could order any follow-up tests promptly, and that really helps get patients out of the hospital more quickly, decreasing their length of stay and cutting healthcare costs.
Well, speaking of healthcare costs and healthcare reform, how do the hospitalist programs play a part in this?
Well, I think we'd all like to have the crystal ball when it comes to what's healthcare going to look like in the next 10 years with all the reform changes. But I can tell you, I think there's several things that are apparent. And one is that hospitalist groups are here to stay and are going to be driving factors in the healthcare reform debate. And also, we're going to be playing a big role in improving the quality of the care and changing the processes in the hospital to save the healthcare system dollars as we move forward.
All right. Well, thank you guys so much. We appreciate it, and good to know that you're there.
Thank you.
Great.
All right, we're back right after this.
The preceding segment was brought to you by East Cooper Medical Center.